Hi, everyone. Good afternoon, and thank you for joining us. We will begin in exactly 1 minute. Hi, everyone. Hello again, and welcome to our webinar today on family inclusion. This is session 1 of our webinar series, and today's webinar is on the family experience. My name is Kathy, and I'm the project coordinator of this center. This webinar is sponsored by the Northeastern Caribbean Mental Health Technology Transfer Center, or MHTTC, housed at Rutgers in the School of Health Professions and the Department of Psychiatric Rehabilitation and Counseling Professions. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. At mhttcnetwork.org. If you're interested in staying up to date with the events and products the Northeastern Caribbean MHTTC is providing, please sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen. Following the webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform future activities. The surveys are also important because our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. We also want to let you know that this webinar is being recorded and will be posted to our website, along with the PowerPoint slides in the next couple of days. This presentation was prepared for the Northeastern Caribbean Mental Health Technology Transfer Center under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Please do not reproduce or distribute this presentation for a fee without specific written authorization from the Northeastern Caribbean Mental Health Technology Transfer Center. At the time of this presentation, Tom Codier served as Acting Assistant Secretary for Mental Health and Substance Use at SAMHSA. The opinions expressed herein are the views of the speakers and do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS, SAMHSA, for the opinions described in this presentation is intended or should be inferred. We encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you, so please use the chat feature to answer those questions. The MHTTC network uses affirming, respectful, and recovery-oriented language in all activities. This includes language that is strength-based and hopeful, inclusive and accepting of diverse cultures, genders, and perspectives and experiences. Language that is healing-centered and trauma-responsive. Language that invites individuals to participate in their own recovery journey. Language that is person first and free of labels. Language that is non-judgmental and avoids assumptions. Language that is respectful, clear, and understandable and consistent with our actions, policies, and products. We have with us today Dr. Michelle Zechner. She is the assistant professor at Rutgers in the Department of Psychiatric Rehabilitation and Counseling Professions. She has focused her career on the promotion of health and wellness for people with mental health conditions, their families, and the staff who support them for over 25 years. She has worked in a variety of settings, including academia, outpatient mental health programs, family advocacy organization, psychiatric hospitals, nursing homes, and training services. She conducts research, teaches, and mentors students, and consults with state psychiatric hospitals on the implementation of evidence-based mental health practices. She is also involved in family advocacy in New Jersey. We also have with us Valerie Ferry. She is the Director of Workforce Development, Family Training and Advocacy Center, and has worked in outpatient, inpatient, and administrative roles within the Philadelphia Public Behavioral Health System for 20 years. She oversees various programs at FTAC that champion the importance of family within behavioral health care and works collaboratively with local universities, behavioral health organizations, and family members to educate the workforce and support providers in their effort to become more family inclusive. Now at this time, I will turn it over to our presenters and welcome again.
Thank you so much, Kati. It's lovely to be with all of you and on a topic that's really important to both Valerie and I. So we're happy to be with you. Next slide, please. Our objectives today, we're going to have a series. We hope that you'll be able to join us for all 3 of the series. We've got some great information, but today we're just going to sort of begin with a familiarization of the perspective of family members of people living with mental health conditions. And I know some of you may work with that population, some of you may be new to it, and some of you may be experiencing more and more families in your settings. We also would like to define family types of support, experiences, and strengths. We know the challenges sometimes that families bring, but it's also important to look at the strengths. Next slide, please.
Okay. Hi, everyone. So before we get started, we're going to try something sort of interesting. We're going to create a word cloud together. So I'm going to encourage everybody to go to this website, menti.com. I'm going to place it in the chat right now. And I'm going to also place your code in the chat. The code at menti.com is going to be 5302 6896. And when you get to this website, we're going to ask you to type in a few words or word of what your thoughts are about how families are perceived. This is just going to be an experiment for us to get a sense of sort of where everybody is and their understanding and how family members are perceived and the work that we're doing. So if you'll just take a second and visit that website.
Right, and it's also in the chat. You can look at the chat. The direct link is the top link. Or if you want to go to menti.com, the code is listed there as 5302-6896. So just take a moment. It's kind of fun to create some art. So could you go over
Just
Valerie?
general family members? Oh, that's okay. So the perception of family. So when you're working with family members in the work that you do, what are some words to describe the perception of family members?
We're getting some answers now. I can see
Okay.
them. Thank you.
So we're going to be watching the cloud grow, and we're going to work on that together. So while we're doing that, and we're getting a sense of what our word cloud is going to look like, if we'd be able to go to the next slide. So keep in mind that today, when we're talking about family, we're going to be discussing this in greater detail a bit later, but really we're talking about a person or people that a client's going to identify as part of their support system. So this really could be many different people. So when you're building this word cloud, think about family in that context. So I'm wondering, Dr. Zechner, how's the word cloud looking? Do we think we're ready?
We're ready. So I'm going
Start
to
sharing it. Perfect.
Start sharing it. Yes. So give you an idea of what we said.
All right. Oh, wow. Okay. So this may grow and change a little bit as we're talking. Yeah, see, look how it will change. While folks are putting information in the Menti. So the biggest one, so apparently a lot of the folks on this webinar has said overwhelmed, that family members are feeling overwhelmed. And I would 100% agree with that statement. I don't think I've ever met a family member who's supporting a loved one who isn't feeling overwhelmed. Stressed. Stress is also something family members are going through. Supportive. I'm really glad that you said supportive, or that many of you said supportive, because I think sometimes family members get a bad rap, but honestly, I meet so many family members who are supportive to a fault. Oh, look, supportive is growing. That's really nice to see. I'm also seeing some other ones like misunderstood, frustrated, overworked. Absolutely. Dysfunctional, I see. Sometimes, yeah, there is some dysfunction in the family, and we're going to talk a little bit about that within this series as well. Not every family is the perfect family, right? But we're trying to find ways to include all families the best way we can. Understanding. Opinionated. Ooh, that's a good one. Family members are definitely opinionated. And we're going to talk a little bit about this series about how that can be used as a strength and as an asset to the work that you're doing. All right, distant. Sometimes family members are distant. We're going to talk about that as well. But the three standouts that I'm seeing there are overwhelmed, stressed, and supportive. So I really think that's really on the mark for what we're going to be talking about in the next couple of sessions.
Yeah. So Kati, I think, thank you so much, everybody, for participating in the word cloud. Would you mind showing us the slides again? Thank you, Kati. And next slide.
Yeah. Okay.
Okay. So we're going to be using the chat to talk throughout this presentation, but I'm curious if anybody had any thoughts about that word cloud before we got started. I see that we had a comment in the chat that said family members are excluded sometimes, and I would say that's true, that we have family members who are excluded a lot of times, and we're going to talk a little bit about that. But I'm curious if anybody had any thoughts before we went on about that word cloud. Did anything surprise you? Or maybe it wasn't a surprise. You can feel free to use the chat if you have any thoughts about it.
And Valerie, I will say that I was surprised that there was both a positive perspective and sort of a more challenged. So there was a little bit of opposite spectrum of, supportive, positive, and also toxic, dysfunctional, challenged, frustrated, Yeah, all of this.
Absolutely. So Katya, if you wouldn't mind going on to the next slide. So I think that's really reflective of the family experience, right? So, we're discussing first perceptions of family members, and it's really unique. It might depend on the family. And that's really what we're going to talk about today is depending on discussing the family experience. And it's important to know that one family member or one family is unique to one family, right? All families are different and their experiences are going to be different as well. And despite those differences, it's really important to understand that the goal is the same. The goal is to make sure that we're including, involving, and engaging families the best way that we can in the services that we're giving. Next slide, please. So it's also important to remember that the makeup of families can look differently. So we gave a very brief definition early on in the presentation about what family is, but families really can look different depending on who we're talking to. So when you think of family, you may think traditional family, for instance, or how we term traditional family. So you may be thinking about blood relatives or the family of origin, so such as mother, father, maybe you have a partner, children. But it may also consist of extended family. So for some families, cousins or aunts or uncles, or the larger family becomes very important when you're considering family. But family may not be related to you at all. You may consider family, or the folks that you're working with may consider family to be a sponsor or a close friend or a group of friends, or maybe a clergy member. These families can be big or they can be small. The important thing to remember when we're talking about family is that family is unique to each individual that you're working with, and that they're really the ones who get to determine and decide who their family is. Next slide, please, Kati. So there's also many considerations to think about when you're working with families. And when you understand their experience, you're going to be better able to assess what they might need in order to give better support to their loved ones. So it's important to understand what families are going through. But it's also really important to see their strengths. And, Dr. Zechner and I talk about this a lot, and family members bring so much strength to the table when they're advocating and working for good services for their loved ones. So it's really important to keep that in mind when you're working with individuals and their families, that family members, they definitely have strength. It's also important to remember that we may not always be aware of what kind of resources families have available to them. What kind of services do they have available? Are they understanding what their loved one is going through? Do they have basic education? We may not even consider things like, do they have the finances that may be expected of them to take care of their loved one? Do they have transportation to get themselves or their loved one where they need to be? There are all kinds of things that we may not be thinking about that family members are going through, but it's something important to keep in mind when we're working with families. It's also really important to keep in mind cultural considerations. I saw somebody in the chat said that different family members may have different cultural norms and values at play. Absolutely. You must consider those things whenever you're working with individuals and their families, because what is normal for your family may not be normal for somebody else's family. So it's really, really important to keep all of that in mind. And I'm seeing such good comments in the chat. Dr. Zechner, family knows their loved ones best. Absolutely. That's why it's so important to keep them engaged and to really understand their experience. Next slide, Kati, please.
Yes, and so I think we've already had sort of a rich discussion about some of these things that are important to families. And Valerie and I have we teach a class, or I taught a class, and Valerie's taught with me on the family experience, and it's so different based on who the family is, who the individual is, what the individual family's role is. There's a lot of different pieces that come to play on what a family's experience is. First, a family member's age will influence their experience. Are they an older adult who's retired on a fixed income with multiple health conditions? Are they a young parent who's working and caring for several children and other family members? Also, the age of the person living with a mental health condition or other challenges can influence the family experience. The child mental health system offers many more in-home services, and it may be more involved with family members than the adult mental health system. Of course, the mental health system is for adults is a lot more focused on privacy, and it may even exclude family participation by default. And someone mentioned that in the chat. Another difference in family experience is the particular role that the individual has in that family. So parents can often feel more responsible for their children regardless of age. And I identify myself as a family member. And one thing that's really interesting is it's a different experience for mothers who are taking care of their children who may have a substance abuse or mental health condition versus fathers. Mothers, fathers, siblings, it's all very different. This can lead to power struggles if an adult is living with their parents. And efforts by providers to improve communication and even learn about caregiving may be necessary. Siblings and spouses, it's a different experience because there's more choice in relating to the person. It's kind of an adult to an adult conversation, but there may be a unique challenge for siblings in that they can worry about passing on conditions to their children, or if they have to work through experiences of loss and anger of having that sibling with a mental health condition. Spouses are unique because they're choosing to stay every day with a person, and there could be significant issues around finances and child rearing if one person is living with a mental health condition and the other isn't. It's also really important that people brought up culture, and absolutely, I think about some of this as social determinants of health. It's important to consider what resources a family has in general, like employment or income, access to healthcare services, the community that they live in, computer literacy and access to the internet services, transportation, whether they have a car, they live on a bus system, access to grocery stores or other places to get healthy foods, physical safety, community resources like faith communities, and other social determinants of health in general. A family with fewer resources may need additional referrals to support services and have less ability to connect with their relatives during times of psychiatric crisis. And also the functioning of what the family was like before the diagnosis. The family was struggling before the diagnosis, more than likely they're going to be struggling after a diagnosis that comes up in the family. Next slide, please. So I'd invite you to, you guys are already participating wonderfully in the chat. I'm just going to ask you, if you think of a family you've worked with or you know of that has dealt with a mental health condition or behavioral health conditions, what are one or two things that influence their experience? Again, think of a family that you've worked with or that you know of who's experienced a behavioral health condition, and what are one or two things that influenced their experience?
Oh,
yes.
Yeah.
NAMI, family to family. I know I'm a teacher of NAMI's family to family. I took the course. I found it amazingly helpful because it really teaches you how to be a parent. And that's a wonderful suggestion. Valerie, did you have something else you wanted to add?
Yeah, NAMI Family to Family is an amazing course. It's tough though, because it's so long, and we find that a lot of families have a hard time being able to dedicate that amount of time to it. So, even some of the basics that you may learn from family to family could be helpful if you're able to pass those on to the families that you're working with. Oh boy, the chats are really coming in.
I know.
Wraparound services, absolutely, some additional support. Yeah, the hidden losses, what a great point. So the clients with hidden losses, such as gay men whose partners have died from HIV and won't receive support. Absolutely. Remember, when we're talking about how families look different, that support that each individual family is going to need is going to look different. Dr. Zechner was talking about how different kinds of families, they're experiencing different kinds of challenges. And it's hard to not have that sort of one size fits all approach to supporting a family because there's so many varied needs.
Yes, and I someone brought up a specific community, the Somali community, and the shame about experiencing that. And that may come up in a person's culture, about the particular shame of the family of having someone with a behavioral health condition, and the parents or guardians having their own personal challenges or past traumas, absolutely. And whether or not the family is getting therapy or individual therapy for themselves can really help or hinder what a family experiences with the system. And there can also be some challenges among Asian communities. I know Latino communities and also African American Black communities also struggle with shame and stigma in particular. So, and also having actually the resources that are available. Thank you, everyone. You all are very sophisticated in your thinking about families, and we're grateful for the work that you do. And American Indian communities and tribal resources can absolutely be a wonderful resource. Next slide, please. So what do we know about families? I think it sounds like you all know a lot, but there was a recent report that looked at sort of across the US of the people who identify as family members. And they found that they're mostly middle-aged females, and the recipient of care or family caregiving was between 18 and 39. And if you think about that particular time frame, it's often the time when someone is diagnosed with a mental health condition, between 18 and 39. And in particular, family caregivers identified providing about 32 hours per week of services. And that might be transportation, it might be housekeeping support, it might be leisure activities, it could be anything. Or for someone who has a lot of challenges, it could be more services as well. Half of the people reported living together, which was pretty high in my estimation, and many provided financial supports to their loved one, which is probably not a surprise to any of us, amount of services that families actually provide. I always joke that as a family member, I never know in the morning if I'm going to be a nurse, a care manager, a party planner, or just a wife. I never know what I'm going to be today. Oh, thank you. And Hector points out that there can be this past generational trauma that really translates into current life experiences. Thank you, Hector. Absolutely. When there's that generational trauma of either mental health conditions, behavioral health conditions, or other kinds of trauma of stigma, discrimination, all of those things can become internalized and make it much harder for the family to be resilient, access services, and get the care that is really needed. Next slide, please. So some of the examples of supports that family offer, I think we've talked about some of these, but they're, we refer to them as the instrumental activities of daily living. And those are the tasks that just help a person remain in the community successfully, like laundry, housekeeping, shopping, preparing meals, medication management, prescription refills, making doctor's appointments, or following up with Social Security or Medicaid. Many families offer support in these areas, even when they don't live with their relative. It can be really helpful to ask the service recipients how they accomplish these particular tasks, and if they have any family providing supports. And remembering, of course, as we talked about at the beginning, that family may not be a traditional family. Their identified family may be friends or faith community or other folks. Transportation, families often help in that area as well. And family members often take a specific role on assisting a person with a mental health condition or behavioral health issue. And these intangible types of support are a little more challenging to describe. It might be coach or teacher of life skills, nurse, case manager, employment specialist, among other things. And this can really add to the stress to the relationship and additional tensions when family members are asked to provide multiple roles in the caregiver. Next slide, please. So there's a little bit of a cycle. Valerie and I talked a lot about this. There's so much stigma around mental illness, particularly in different cultural perspectives, but across culture as well. I would say it's a pretty stigmatized thing to say that I have a family member who is living with a behavioral health issue. And it comes from media, it comes from our cultures, especially if families feel ashamed or unwilling to share information with their supporters. This might lead them to feeling more isolated and alone with sometimes very difficult situations. The recent report on caregiving reported that about a third of respondents said they had experienced some type of violence in the past year. Of course, that's not the norm, but what's interesting, unfortunately, is typically mothers are often the target of violence. So we need to be aware of that when we're talking to families. That mother, as helpful as mothers can be, they can sometimes, of course, be over helpful, but they're also at high risk. So teaching communication skills and methods of de-escalation are really, really important for folks who live at home with their families. Also, there can be challenges finding services. I think every family I've ever talked to or met has talked about the difficulty of getting a proper diagnosis or medications that are needed, or even what services are available. In New Jersey, we're so fortunate. We have a free service called Intensive Family Support Services that's paid for by the state, and families, there are representatives in each county, and families are welcome to get this support and referral and linkage services. However, not every family member knows about this resource. And I'm sure there are other resources in your communities that people are aware of that they just aren't connecting with. And then the challenge is that when they do show up for a provider, they may have significant problems talking with the provider. And that's something that comes up over and over in the research is family members don't feel listened to, they don't feel respected, they don't feel heard by the provider. This could be obviously because we have to talk about the elephant in the room, HIPAA, or hippo in the room, I should say. It could be that because provider staff are concerned about HIPAA or believe that the symptoms the person is experiencing is related to family dysfunction. So blaming the family for the individual's behavioral health condition, or even the old-fashioned schizophrenic mother, where mothers are blamed for their children's development of schizophrenia or illness. So this cycle isn't necessarily the experience of every family, but most families I know could definitely relate to feeling stigmatized and isolated. Also struggling with how to get proper interventions, diagnosis, or providers that will help their relative and also communicate with them. Next slide, please. So I'm going to turn it over to Valerie now.
Okay, so we're going to take a moment and think about our own experiences with families. So, you know, when we're professionals, we're wearing a professional hat, but we know that we all come from somewhere. We're not hatched. All of us have folks in our lives who either are family members by blood or support persons that we care about and care for. So it's pretty likely that many of us on this this training have experienced a situation where you've supported somebody who's either gone through a medical illness or a mental health or substance abuse treatment need. So take a moment to think about a situation like that. And then I want you to ask yourself this question, and we can talk about it in the chat. The first question is, what was challenging when you were providing support to that family member or person that you care about in that situation? I would imagine there were some challenges, but if you feel comfortable sharing, okay. So someone is saying that they were a mom, they got blamed by a whole community. Mental health is about your will. Medication and medical care is the last resort. Providers have their own experiences of stigma in having a family member. Oh, that's a really good point. Any challenges? Mother denied she needed help, right? Resistance on the ill person's end. Yeah, maybe you're trying to provide care and the person doesn't want care or help. Confusion, causing me to feel like a failure. A lot of waiting during time. Oh yeah, that's it. So yeah, so the waiting and the sort of going through the process can be extremely frustrating. Keeping in mind the roles that the person has in their life and why they feel the way that they feel. Okay. Managing your own frustrations and how to support them. Yeah. So lots of challenges, right? When you're in that situation where you're the family member who's supporting that person, so many challenges. So I'm curious on the flip side of that. So what was helpful in that situation? What did you get in that situation that was assisting you or helping you out? So hopefully there was a flip side to the situation where you were getting something that helps. Self-help groups, nice. So somebody was utilizing self-help groups. That's a key tool for many family members. Telehealth. I don't want to say that there is a silver lining to what we've all been through in the past year, but telehealth has been an incredibly useful resource for many people and their families. That you were educated in the field. Yes, being educated in the field can really be a game changer for you when you're navigating a system and trying to support somebody. So family support groups through NAMI, excellent. So that was a help for one person. So what strengths did you bring to the table? Somebody already mentioned it, that they had some understanding and knowledge of the system, but what strengths did you bring to this situation when you were supporting your loved one? Compassion, being person-centered, excellent. Being unbiased, okay. Keeping bias in mind is something that some of us who are in the professional world are trained to do. Resilience, keeping boundaries, and hope. Ooh, hope is such a good one. Being patient, having firsthand experience, very helpful, right?
And listening, Valerie, you're listening.
What's that? Listening.
Listening.
Keeping a sense of humor. It is sometimes hard to have a sense of humor when you're scared and feeling worried for somebody, but that's truly important. Being able to have courageous conversations and not get frustrated. Wonderful. These are some great answers, everyone. I really appreciate you thinking through this scenario. So what I want you guys to think about is, actually, next slide, Kathy, if you wouldn't mind. So kind of based on our previous conversations, the fact that many of you know a lot about the system and how it works allows you to be a different kind of support to your family. But put yourself in the place of a family member who may not have some of that education, who may not have some of that background. And I think it's pretty easy to see how frustrating and concerning it can be. And some of the really basic things that family members could use and could be helpful for them in navigating the system for their loved one. So like Dr. Zechner was saying before, many families, they go into these situations and they're not feeling as if their presence is wanted or needed. In fact, families often get the impression that providers don't understand what they need, that they're devalued, that they're disrespected, and at times, as Dr. Zechner mentioned, outright blamed for what's going on in the home. So families feel that it's these kinds of beliefs that causes a lack of empathy, and their needs are the reason their needs are not heard. So that instead of the focus being on sort of how can the family contribute and assist with the process, the focus is shifted towards what the experts think, and creates sort of this us versus them dynamic, which is generally not helpful to the treatment or service process. And it creates an atmosphere that doesn't really acknowledge the strength of what families can bring to the table. And that can be crucial. What families bring can be really crucial to somebody's recovery. So listening to family members, their history of how the individual has been prior to the illness, during the illness, after the illness, getting a perspective of what's going on with them and the family and their experience can really be a key component in understanding the person that you're working with. And it's really a great first step to create an opportunity where the family can really be a part of the team and start working towards shared goals for the individual and services. Next slide, please, Kathy. So I'd like to go over a vignette really quickly about a family member and think about this scenario, and we'll talk about it a little bit. So Mary's 34-year-old son, Danny, has recently been hospitalized after a manic episode where he quit his job, bought a new car, and accidentally lit a fire to the home. Mary knows what hospital Danny has been involuntarily committed to. However, when she calls, she can't get anyone to listen to her. She explains to the social worker that she knows Danny is there and that he will sign a release of information if he's asked to do so. Mary tries to tell the social worker that generics have not helped him in the past and that Clozaril has. She shares that her son was stable for several years, but was recently diagnosed with diabetes, and it seems that his diabetes medication worsened his mental health. The social worker simply says she can't talk with Mary and hung up the phone. Okay, so next slide, please, Kati. So let's talk about that for a minute. So thinking about what we've discussed today, thinking about a family member's experience, looking at that scenario, what are some of the emotions that Mary might be experiencing in this situation? How might she be feeling? You want to put it in the chat and we can keep the conversation. Frustrated, helpless. Yes, absolutely. Hopeless, angry, helpless, confused. Absolutely, right? Powerless, alone. Oh my gosh, we could create a whole Menti based on this alone. Absolutely. This is a very frustrating situation for a family member who does know what's happening and has a good relationship with their family member, and they call and they try to engage in a conversation, and they're just not able to be able to communicate. So my second question is, what are the strengths that you can identify that Mary has in this situation? Can you see any strengths that Mary's bringing to this conversation?
I see one, persistence.
Oh, yep. Call for someone else. That's a good recommendation. I would recommend that as well. Yes, Mary is an advocate. Good historical information. Absolutely, right? That's a crucial part of what she's trying to communicate, which is my son was doing very well until this medical incident happened, right? So that's really important information, knowledgeable, knowing what medication does not work, right? And you'll find that family members are bringing these strengths to the table. They just need someone to be able to discuss it with. So what resources do you think Mary has here? You've mentioned some of them already. Yep, being a family member, that's definitely a resource. Knowing what medication works and what medication does not, absolutely. Any other resources that Mary may have? All right, so I'm going to ask you the big question. What concerns do you guys have about this information, about this scenario? Do you have any worries about how this went? Okay. Totally ignoring her. Yeah. Social worker doesn't understand confidentiality laws. Very good. Okay, maybe hanging up the phone. Yeah, I would agree with that. That was not very nice. Can create a bigger issue. Thank you, Carmen. Absolutely. Great pickup on that. So now that you had a chance to think about what you didn't like about the situation, how do you think this could have been handled differently? So if you were the person on the other end of the phone, what do you think you would have done? I know you guys have good ideas. You've had such good feedback. You would have paused. Okay. Take a minute. Would have taken her information, would have explained the process, and would have followed up. Great. Put myself in her shoes. Try to use her information about the medication and document the official report. All right. Acknowledge that she can't give information, but can take information without breaking HIPAA. Someone's getting a gold star for that. Absolutely. Look for opportunities. Perfect. So I'm curious, in this scenario, with the approach that was used, with a different approach, how might that impact Danny? So if we're taking a different approach than what was taken in the scenario, how could that have helped Danny? Better care, exactly. He gets quicker, more effective treatment. Building trust and engagement, wonderful. Better care, great, exactly. So I would have mentioned this is actually loosely based off of a true story, off of somebody that I know who said that I could use their story for this presentation. So this is actually an example of what has happened to a family member that I've worked with. And it's important that we keep that in mind when we're working with family members. There's a lot that we could be getting and a lot that we could be doing that will lead to better care and outcome for the folks that we're working with if we can just take a minute, think about what the information is that's coming towards us and using that effectively and being kind.
And Valerie, can I jump in for a moment?
Absolutely.
I see Chris mentioned that mother stays engaged with providers. In a scenario like this, when I worked on a helpline for families, I would have so many families call me and say, my son, daughter, usually it was a parent, is getting discharged from the hospital. The hospital won't talk to me. They think they're coming home. I don't know what to do because the hospital won't talk to me. I don't know if you all have ever had experiences like that as from the provider perspective, but how frightening for the family to be sort of like shut out of the situation. And then the person in the hospital is making plans to be discharged to their home, and they, the family doesn't know anything about it at all.
Yeah.
So, yeah.
All right. Next slide, Kathy.
So this is a wonderful opportunity. It sounds like you are all pretty savvy. I'm really pleased to hear all of your comments, because it seems to me that you've been thinking about families and curious about how to engage families further, which really makes Valerie and I very happy, because we're very passionate about making sure that families get a seat at the table and a little more compassion. And I always feel like I'm on roller skates, like kind of like on one side and the other, because I was a provider before I was a family member. And so I know from a provider perspective how challenging it is to work with families. And once I became a family member and realized how terrifying it is that someone you love suddenly is a completely different person, then you go to the ends of the earth to try to figure out what to do and how to help the person. And that doesn't help the provider when a family is so distraught. And I think it's almost like first it's to engage the family to just listen, because families don't always feel heard. And we'll talk more about that next time. But I encourage you, this is a practice opportunity for many of you. The next time that you interact with a family member, and some of you already suggested this, so bravo to you, ask yourself, what emotions is this person experiencing? Like, put yourself in their shoes. And you already listed some things earlier, that a family who suddenly, for many families, as was my situation, it happens overnight that you suddenly become a family member. You knew something was wrong, but you didn't know how wrong it was. And there's such and we'll talk about family recovery as well. There's such shock and overwhelm and denial initially that families just kind of need a minute, and they need somebody to sort of meet them where they're at. And people are saying, this happened to someone's sister regarding their husband about the discharge, where it's a shock that they're going to be discharged home. And people are sharing their stories. Thank you so much. When I became a family member after being a provider, I moved from saying to a family member, don't take it personally, to it's hard, isn't it? Absolutely. I feel like that was the benefit. I don't want to, like, it's all about me, but NAMI was so helpful because I knew how to be a provider, but I had no idea how to be a family member in this way. And making sure that families are not alone, get connected with other families in similar situations. Yes, absolutely. And we're so fortunate. Maybe your communities are this way too, but our NAMI New Jersey is very multicultural. So there's the a program specifically for African American and Black family members. There's South Indian, South Asian groups that are put together. There's a Chinese American group. So using the language, the culture of a self-help is really, really important. And absolutely, having telehealth means that family involvement is crucial. The client might not have access to a phone, or maybe too depressed to answer. That's a really great point, Hector. Thank you for making that. And in fact, I've done some research on telehealth and during COVID, and one interesting finding that came up over and over was there was a greater use of collateral contact or reaching out to families or landlords or friends or people the person may consider a family member. And so telehealth absolutely means that we have a greater range of connection to people and trying to track down people who may not have a place to live at this moment. And absolutely being a support to people who've never had to deal with this when it happens in your own family. I remember becoming a family member and my social work friends all saying, so what are you gonna, where are you gonna turn for help? And I was like, I'm telling you, but they didn't really want to hear about it. They didn't really, and that's not all social workers, but those were just the professional contacts that I had were not very interested in being a support to me at the time. So also really understanding that families have strengths. We know that families, when we have contact with families, 9 times out of 10, it's at a crisis. They're really not doing well. They're not feeling well. But how do we take some of those things, just like we would with our service recipients or clients, and sort of flip it and say, how is this a strength? How is this, calling me every day and asking what's happening with my child? That's annoying from a provider perspective. But if we use a strength lens and strength spotting and say, you know what, that mother must have incredible energy and commitment to her child, and she's really going to be key to recovery, because we know research says over and over that families are critical for helping in terms of recovery for people with behavioral health issues. So it's really key. Valerie, did you want to add something?
I did just want to come back and talk briefly about support and how telehealth has actually made it so that things like NAMI support groups are extremely accessible. So I know you were all participating from all over the country. Just Google searching the type of NAMI support group that your family member that you're working with needs can actually garner a lot of results. And even if you're in Arizona, you may be participating in a NAMI support group in Philadelphia, for instance. So using that technology to your advantage to get family members connected to support can actually work. And yes, Dr. Zechner, I 100% agree about strengths. I think as a provider, we don't always see the assets of families, and really, I say this all the time, they'll go to bat for you every time. If they know that you care about their family member and you two are on the same page, they're going to be in your corner almost always. So what a strength family members can add to the treatment team.
And Hector, you're just speaking my language today, sir. You said, let's not forget, we the helpers also have to care for ourselves. We can't help others if we don't help ourselves. And that's a message we as providers really need to remember, that in order to talk to a family member or do anything that needs a little more sort of sensitivity or energy, we may need to take a deep breath. We may need to take a pause before we engage with that situation. Because if we can feel calm and have some presence of mind to be with the family and listen to them really from the heart, they will sense that. Even if you're not able to answer their questions, even if you're not able to give them the information they want, even when you can't solve the problem, listening is a true gift, and really being authentic and just caring. And there's, I think next week we talk about that sort of disconnect about readiness. So families have to be sort of in a ready place. Often in a crisis situation, they can't hear, why don't you take care of yourself? Go for a vacation. That's not the time. In a crisis situation, a family member really needs to hear things like, okay, this is what's happening. This is the prognosis. This is the medications. This is, sort of where you go for help. These are the next steps. It needs to be very concrete information, and self-care for families, it is critical. I know that. I have my family cape and I try to, take it off once in a while and let it sit on the peg. But I'm pretty prone to over care, because that's just who I am. But learning how to do self-care actually takes time, and you have to, as a family member, be a little more recovered. in the recovery process. So we'll talk more about that readiness aspect, and having family support groups. Absolutely. It's so critical. If you can't provide them in your organization, to at least refer out to, I know NAMI has them, but also in our area, Mental Health Association has some. There's also an organization called the DBSA. Oh, now my brain is just blanking. Depression Bipolar Support Alliance. Whew. Go ahead, Valerie.
Yeah, but there may be ones in your local area, and maybe and one of the best things that you can do is share that information with your peers and your colleagues, and make sure that they have that toolkit readily available. I talk to providers all the time who don't realize all of the family supports that we have in our area, Philadelphia, which look different than Dr. Zechner's area in New Jersey. So I'd really encourage you to check out what might be happening in your own area, and how you might be able to link family members and get your peers and colleagues also familiar with some of those support groups.
Absolutely. Next slide, please, Kati. So at this point, I know we had a raised hand and we were sort of getting through some stuff. I don't know if anyone else has a question at this point. If you'd like to place it in chat or a comment, we welcome those at this point. It's just such a great, you guys are really, really a sophisticated group. So it's a pleasure to hear your thoughts and input in all of this.
It's always nice to be talking to folks who share your thoughts and feelings about the importance of engaging families. So this has really been so nice to hear you all really speaking to what it is that we're trying to communicate, and we really do appreciate it.
Yeah, and I do want to go back. I mean, several folks did identify as being both a provider and a family member. There's a really wonderful book. You may be aware of it. It's just my opinion, but there's a psychiatrist named Dr. Xavier Amador, and he wrote a book, I'm Not Sick, I Don't Need Help. And he talks about his brother who has a mental health condition and how to communicate. And I know that the family support services in our area have actually used his book to create sort of a communication map of it's called LEAP, the LEAP method, listen, empathize, agree, and partner. And that's just really not trying to correct someone who's actively experiencing a delusion or a thought distortion, but just listening to what is the message behind that and how important it is for families not to correct the individual, if they, if they're saying something unusual or odd, it isn't that helpful. So someone has a question about seeking mental health services in New Jersey. You could certainly email me. My email is michelle.zechner@rutgers.edu. And if I can help in any way, I will definitely do what I can. I would probably refer you because at this point, of course, I'm in academia, but I do know some resources. Thank you, Kati. And the resource book information, okay, let me just put it in the chat.
I just did. It's on Amazon, but of course you can get it in lots of different places. I'm not recommending you necessarily get it from there, but that should take you directly so that you can see the book.
Yeah, I've heard him talk and he's really wonderful. And then, he also had some experience with depression. He said it's just really, really hard. I find his book helpful and I've recommended it to a lot of families. Anyways, so Xavier Amador is pretty awesome. Next slide, please. So this is just sort of a preliminary introduction, and it sounds like you all are fairly advanced. So we welcome you to come back next week where we talk about the stages of recovery for family members, because that's a little more, advanced. So we're going to kind of proceed along the way here because we know we've got people from all different locations and backgrounds. But today we wanted to focus on how families feel. What is the experience of being a family member, and how isolated they can often feel and stressed and also unheard. And I think many of you picked up on the frustration and the anger of all that. Families offer resources and support. As many of you pointed out, families are a book. They're a huge life experience, and they can, definitely give information about the person, what they look like when they're well, what's important to them, how, what else is available in terms of resources and support. So definitely being aware of that is helpful, and having that in your mindset, I think, makes it a more positive interaction. If you think, what, this family is a resource, even if they've got challenges, they do have some strengths, and I'm going to look for those strengths and I'm going to use them. Experience of being a family member is influenced by so many things, not the least of which is what you all pointed out, which is the family member's own mental health and or physical health, and culture and the social determinants of health and what that looks like. And finally, it's really important to address as a provider the emotional experiences and strengths of families, so that we are knowing where they're coming from when they come to us, which is usually not in great shape. Next slide, please. Here are some resources that Valerie and I particularly find helpful, in addition to, I just threw the Amador book out there, but I was remembering that was helpful. And there's a question, Kati, about the link to register for the next session. I'm not sure if I have the answer to that.
Yes, thank you for that question. I will, in our follow-up email with the survey link, I will include a link to register for the next session so that they have it available and they can share also. Please feel free to share as much as you can.
Wonderful. Well, thank you all very much for a wonderful lunch hour. I really enjoyed my time with you, and I look forward to our next week. And I hope that many of you can make it, because it sounds like you've got some great things to offer.
Thank you, guys.
Yes. Thank you. Thank you everyone for participating. Thank you again to our wonderful presenters. I will be forwarding this QR code as well as our bit.ly link. That's our evaluation code. And again, these evaluations are closely tied to our funding. So we ask that you please take a moment to take our brief survey. And we hope to see you at our next session. We hope everyone has a great day, and feel free to contact us if you need anything. We will.